It has been over 50 years since the contraceptive pill was introduced to women in Australia, and since then, 50 to 80% of women will have used a pill at some stage during their reproductive lives. Women all over the country are having conversations every single day with their doctors about choosing the right contraceptive pill. Recently, there seem to have been a lot more serious side effects of the pill coming to light. Whilst these side effects, such as blood clots in the heart and lungs, stroke, and deep vein thrombosis, are there for any kind of the contraceptive pill, these risks are usually quite low. Except for two brands in particular, Yaz and sister brand Yasmin. Both these pills are manufactured by Bayer Pharmaceuticals and were marketed as a super contraceptive for treating acne and PMS. But it seems that these pills didn't live up to their potential as a super pill. In fact, far from it, with thousands of injuries and almost 100 deaths worldwide attributed to the Bayer pills.
Polycystic ovaries is an abnormal growth of cysts growing on your ovaries. Pretty much means you're struggling to have kids. My eggs probably aren't going to be capable to be fertilised. It leads to discomfort. You can feel them erupt if they get too large. Had an x-ray and it was about the size of a golf ball, he said, but it wasn't big enough for him to dream. I believe that the cause of these polycystic ovaries was the pill. I was on Yaz for about 6 months and I started getting cramps towards the end of it. I went to my doctor and he said, have you ever heard, looked up the history of it? I never looked up the history of Yaz, and then I started seeing on the news that people were getting cramps and clots, and the doctor said that's probably the reason why you got them. So I'm definitely not going to have kids.
Family Planning New South Wales leads the state in providing exceptional reproductive and sexual health services. Their trained experts provide advice on contraception, sexual health and research and education. They are a non-for-profit organisation that caters for everybody in every family. Dr. Mary Stewart spoke about choosing the right contraception and minimising the side effects of the contraceptive pill.
But there are lots of different pills available, and not every pill suits every woman. So it's really a matter of sometimes finding the right pill for her.
In your opinion, can you say that there is one brand that is generally safer than another?
Well, I think the important thing to think about is assessing the woman for safety to use any pill. So there is a risk of blood clots with the pill, what we call VTE, and that risk is slightly higher for women who are taking the pill compared to women who are not taking the pill.
And what are your comments on the safety of the contraceptive pills Yaz and Yasmin?
All pills have a risk of VTE. There are, as I said, some studies that suggest that the newer pills, and it's not just one particular type of pill, but that all of the newer pills quite likely. There are lots of pills available on the market, and most of the pills these days are actually very low dose, so they're between 20 to 35 micrograms of estrogen. Along with estrogen, the combined pill also has progestogen, so there are two different types of hormones in the pill. We know that it's actually the estrogen that's responsible for some of the safety concerns with the pill, such as VTE risk, and so the lower the dose, the better it is. I think it's important for us to realise that the pill is a really popular form of contraception for Australian women. There are lots of options available, and it's important that we listen to women and what their concerns are, and also that they get help from health professionals if they're having concerns with their contraception.
Bayer Pharmaceuticals could not be contacted for comment. Melanie Canosa, UTS News.